Thank you for coming. My name is Dr. Ashwin. I have with me Dr. Soundri and Dr. Sugipriya with me. We are talking today about MIGS, that is Minimally Invasive Glaucoma Surgery. Minimally Invasive Glaucoma Surgery is a surgery that is performed for glaucoma, which is an eye pressure condition. Eye pressure condition le we are trying to reduce the pressure of the eye so that it causes less damage to the nerves of the eye. Nerve of the eye gives us vision by sending those impulses to the brain. Now, when pressure of the eye increases, this pressure causes first peripheral vision to go down, and it comes to becoming a tunnel vision, which is what we want to avoid. அதுக்கு அவாய்ட் பண்ணனுக்கு we are trying to do a MIGS procedure. MIGS procedure is done in mild to moderate glaucoma, where we are trying to put a stent in the eye or a bypass, or let's call it a keyhole surgery for glaucoma, where we are doing this with a small stent using the eye's own anatomy. Kannuga anatomy, we are trying to use that same anatomy and just create two stents, apply two stents in that eye that allow the flow of fluid outside the eye. We are trying to reduce the pressure by allowing fluid outside the eye. This is mainly called MIGS, Minimally Invasive Glaucoma Surgery. How is it different from the conventional surgery is because I am not creating a new channel, I am not creating a bleb, I am not causing any trauma. The healing in MIGS is faster. I have freedom from using drops. I don't have to put drops every day, or at least my drop application has come down by 50 to 60%. And I have had more than 60 cases being done in Agarwals Eye Hospital right now, and we have had 85% success rate in this. Insurances across the world, including India, cover MIGS as a procedure and also allow the patients to have freedom from eye drops, freedom from next day they can move around and do all their activity. No need of any local anesthesia or general any anesthesia except for drops. We can do this just under application of drops. These are some of the bigger advantages of MIGS procedure as a whole. I want to give one major message. Please be aware of a disease called glaucoma. Get yourself screened as soon as possible because it is called a silent killer. Silent killer because it does not have any symptoms till the end. Till the last you have last vision left, you will not know that you have glaucoma. The only way to know you have glaucoma is to come to the hospital, get your eye pressure checked, not blood pressure. Blood pressure and eye pressure are different. Get eye pressure checked. If you have family or family who has glaucoma, there is a higher chance you will have glaucoma after the age of 40. So keep that in mind. So symptoms are very simple. The early symptoms are around the lights you will start seeing some halos. The later on symptoms will be you will not be able to suddenly see the steps below, so you start falling down. You will not see something on the side, you will be hurting yourselves. These are some of the conditions that you have to be very worried about. But more importantly, just screen yourself annually once. Once a year, if you screen yourself for just eye pressure, you will have a much better situation there. One of the big advantages of MIGS is you can combine this with cataract and glaucoma at the same point of time under just application of drops. There's no need of major anesthesia or anything like that. Under just application of drops, within a span of 15 to 20 minutes, both procedures are done and you can go home scot-free. More importantly, next day or a week or so after, there will be no need of application of any drops for glaucoma.
Way back in 2012, when my vision was very blurred, I had gone for a checkup. This was in Dubai. I was working in Dubai for around 18 years. So during that 2012, I had some vision problems. It was virtually blank, Prior to that, when I was in Chennai, way back in 2004, 2005, I had this transient ischemic where my vision was totally blurred. I was rushed to a hospital, then I neglected it. So when I was in Dubai, when I checked my pressure, it was 80%. Okay, so I was on drops for virtually 12 years. Then when I approached Dr. Agarwals Hospital, here also I was under drops. Claviton is the drops which you normally use for this. And I had my surgery. I met Dr. Sugipriya. She told me it's better that you put a stent. It'll be this is a mix. And I had my surgery. It was just a process of 20 minutes. Along with that, my cataract was also done. So now the pressure is under control. We had a recent checkup also. It's under control, well within the limits.
Sir, are you using any drops right now?
No, I'm not using any drops. No.
So that is one of the biggest advantages, and I think he should tell his story about before and after. So can you just share a little bit about before?
Before, it started off with blurredness and blindness. Then I had applied drops, but applying drops is a pain. Because early morning, after every 12 hours, you need to apply drops. So sometimes I would miss. So weeks I might miss. Then again the pressure will shoot up. Because once you're on the work pressure, you tend to miss out on your drops. So I would say this is any day better. The mix is any day better. Because you're free from drops. And drops aren't cheap. That's what I would say. In Dubai it's covered in insurance, but India is not covered in insurance. That's it.
For an opening பண்ணிருக்கேன் extra. So basically one opening I am destroying tissue and using that pathway to open a new channel and make a bleb. ஒரு bleb மாதிரி conjunctiva மேல இருக்குறேன். So this is the conventional method. It is called as drainage. This is a drainage procedure. So I'm creating one pipe இருக்கு, ஒரு pipe block ஆயிடுச்சு. I'm opening a new pipe to make it so allow the water to drain. This is what is called drainage procedure, aqueous drainage. So MIGSல என்ன இருக்கு? MIGS is minimally invasive glaucoma surgery. Minimally invasive means I am not breaking anything new. Same normal eye anatomy என்ன இருக்கு அதே யூஸ் பண்றேன். So what are the advantages? Why should I do it? எப்படி பண்ணணும்? So what am I doing? Go back and forward.
Can you explain again? Yeah.
So what I'm doing here is என்ன பண்றேன்? So this you understood. Now இதுல small opening, only angle. You see the angle around 360 degree ஒரு angle இருக்கு கண்ணுல. அந்த angle-ல போயிட்டு you're going to make a just implant one stent. It is stent இருக்கு, keyhole மாதிரி surgery இருக்கு. No opening, nothing, no breaking. Just put 2 stents and now the flow is through that. As the flow is coming through that, what we are doing is using a keyhole surgery. You are making a minimally invasive glaucoma draining system. So it's again draining using the body's own anatomy. We are not changing anything. Nothing new is being broken. No opening of a new passage. No bleb formation. None of that. We are using same channel. Only thing what happened in this patient, these things got blocked. So I'm making an opening. It will allow the passage of this drainage. Other than main the MIGS layer, what we are trying to do.